The following program contains mature subject matter. Viewer discretion is advised.
Women often complain that that time of the month can be annoying, but it can also reveal a lot about your health. So Dr. Nita has the colorful explanation for all of us.
Yes. For example, if you're an avid runner or you're an athlete, then you may have a lower estrogen level, and as a result, you'll notice a lighter period. It may just be like a light pink color. Now, the issue with that is when you have lower estrogen, we think about health complications like, weakened bones down the line, or we think about your heart health or even fertility. So if you notice that your blood is just a light pink and that's all you're getting, or if you notice that you're not getting a period at all, then that's something that you want to talk to your doctor about.
All right, so what about normal colors?
A normal period can last up to 7 days. Now, when your period is heaviest, then it'll be that bright red or that cranberry red color. But on the days before and the days after, during that 7-day window, you might notice that it's brownish or almost like a blackish color. That's not a problem. It's not a big deal. It's just that that blood is taking a while to get out of your body. So it's exposed to oxygen, and then it undergoes something called oxidation, and that turns it the color. So it's not a big deal. It's just that it's coming out a little slower. Now, if you notice that you're spotting in between periods, or if it's going beyond the 7 days, then chat with your doctor once again.
All right, so if those are the healthy colors, what unhealthy colors should folks look out for?
One, for example, would be like a grayish color. If that happens, then it could indicate that there's an infection, especially if you notice that it's associated with itching or an odor. But overall, even if it's not gray, say you're having like a normal menstrual period, but you're saying there's a foul odor, or it itches, or it's heavier than normal, or it's really, really clotty, I have fever, a lot of abdominal pain, anything that's out of the norm, then let your doctor know, because that can indicate an infection, or in some instances, some women could be having a miscarriage even if they didn't know they were pregnant. Now, I'm not saying that's always the case, but if it's anything outside of the norm, talk to your doctor just to be sure.
We talked about colors, but what about in the case when it's clear?
So when it's clear, not necessarily on your period, but between your periods, you'll have vaginal discharge. And that vaginal discharge can vary in consistency. So just a tip, whether you're trying to get pregnant or you're trying to not get pregnant, keep this in mind. At a certain point during the month, then it'll be like the color and consistency of egg white, almost really, really stringy. That's the fertile stuff. That means your body is ready to make a baby. So that's your body trying to help the sperm get to the egg. So that's that cervical mucus.
Typically like mid-cycle?
Mid-cycle, around the time you're ovulating. So yeah, around the time you're ovulating, that'll happen. And then around that time, your libido might go up because, nature wants you to make babies. Men
can sense it when you're ovulating.
Did you know about that study? Did you guys read about that study about ovulating?
This is very important, so take out your notepads. According to this study, strippers make more money when ovulating. But here's the thing, even if you are not a stripper, you can still use it though, because from an evolutionary standpoint, evolution wants men to want you when you are ovulating, right?
Fascinating.
It's fascinating. So even if you don't strip, if you want that nice handbag, right, maybe you should ask when you're ovulating.
It's truly fascinating.
It is truly fascinating. And just the fact that your menstrual period tells you so much about your body. The American College of Obstetricians and Gynecologists, they literally wrote a committee opinion. So they did a write-up about kind of using your menstrual period as a vital sign. So just like you look at the blood pressure and the heart rate, it can tell you that much about your health. So when it's off, talk to somebody.
Now, I'm curious, should a woman, and I know this is going to sound maybe a little bit gross, but much like we'll tell people to take a picture of their bowel movement if something's looking off, obviously a woman may not be able to get in to see her doctor right in the period of time when she's having her menstrual cycle. If things look a little different, you take a picture of the color so you can say, hey, doc, this is what things are looking like. Because you have patients, do they do that?
So why not?
Not only do patients bring me pictures, they will just bring me stuff. They will bring, they start pulling out bags.
Doc, here you go.
They do. They bring me up.
Well, thank you for bringing that in and sharing. You should do a coloring book.
I
for
should.
Women. Yes.
For women, yes. Coloring is therapeutic. It's good, and it's educational.
Well, I love this lesson on the colors of your menstrual cycle. Thank you very much, Dr. Nita.
Thank you.